Have you ever wished to wake up every morning feeling energized, with legs that are strong, stable, and ready to carry you through the day with ease? Imagine no more painful leg cramps, no weakness when you stand, and no fear of losing balance during your daily walks. Whether you're in your golden years or simply want to preserve your mobility and independence, the foundation of leg strength lies in one powerful word: nutrition. In this in-depth guide, we'll explore 7 of the most powerful vitamins and minerals that can transform your leg health. These nutrients support muscle strength, bone density, nerve health, and circulation, all crucial factors in maintaining powerful legs. So, if you're passionate about staying active, whether it's walking, dancing, or simply moving confidently, then this video is just for you. Make sure to like, comment your thoughts or questions below, and hit that subscribe button so you never miss out on life-changing health tips. 1. Vitamin D. The sunshine vitamin for stronger legs. Why it's important. As we age, it becomes harder for our bodies to maintain muscle mass and bone strength. One of the biggest silent culprits behind this decline is a deficiency in vitamin D, a nutrient that's often ignored until it's too late. Vitamin D isn't just about healthy bones. It's a key player in how your leg muscles move, react, and support your balance. It helps in protein synthesis and ensures that signals from the brain are efficiently transmitted to your leg muscles. How it affects your legs: weak or cramping muscles, loss of balance and increased risk of falling, slow reaction times and stiff joints, poor muscle coordination. Why deficiency is common. Older adults often spend less time outdoors, and even when they do, their skin becomes less efficient at absorbing sunlight to produce vitamin D. This leads to widespread deficiency, especially in people over 50. Health risks of deficiency: muscle weakness and cramps, increased risk of fractures, poor balance, higher chance of falls and injuries. How to boost vitamin D naturally? Get sunlight. 15 to 30 minutes of morning or late afternoon sun exposure is ideal. Eat vitamin D-rich foods. Fatty fish, like salmon and mackerel, egg yolks, fortified dairy products, and mushrooms. Use supplements, especially for those with limited sun exposure. Dosage can range from 800 to 2,000 IU daily, or more if prescribed. 2.5 Calcium, the backbone of bone and muscle health. Why it's important. When you think of calcium, you probably think of bones, and that's correct. But calcium also plays a huge role in muscle contraction and movement, especially in the legs. As we grow older, calcium loss from bones increases, putting us at risk of fractures, especially in critical areas like hips and thighs. Without enough calcium, even simple movements can become painful or difficult. Symptoms of deficiency: leg cramps, especially at night, muscle spasms and weakness, increased risk of falls and fractures. Best sources of calcium: dairy products, milk, cheese, yogurt. Plant-based options: almonds, tofu, leafy greens like kale and bok choy. Fish with soft bones, sardines and canned salmon. Fortified foods, plant-based milk and cereals. Bonus tip: always pair calcium with vitamin D for better absorption. Also, incorporate weight-bearing exercises like walking, dancing, or light resistance training to help your bones retain the calcium. 3. Vitamin B12. Nerve power for stable legs. Why it's important. Vitamin B12 supports the nervous system, ensuring that your brain can send quick and accurate signals to your muscles. This vitamin is essential for coordination, reflexes, and muscle control, especially in your legs. A lack of B12 leads to misfiring of signals between your brain and your muscles, resulting in leg numbness, weakness and unsteadiness, tingling sensations and fatigue. Why deficiency is common in older adults. Decreased stomach acid reduces B12 absorption. Use of medications like antacids and metformin. Low intake of animal-based foods. Conditions like gastritis or chronic digestive issues. Health risks of B12. Deficiency. Irreversible nerve damage. Poor balance and falls. Cognitive decline and memory issues. How to get enough vitamin B12. Animal products. Lean meats, dairy, eggs, fish, and shellfish, especially clams and liver. Fortified foods, cereals, nutritional yeast, and plant-based milks for vegetarians. Supplements or injections. Safe and often necessary for older adults. Excess B12 is excreted naturally. Unlocking the secrets to stronger legs. Essential nutrients for seniors. As we age, maintaining leg strength and mobility becomes increasingly vital. Aging doesn't have to mean a decline in vitality. With the right nutrients, you can enhance your leg health and overall quality of life. Magnesium. The muscle and bone guardian magnesium plays a pivotal role in regulating calcium transport, ensuring it's directed to bones rather than soft tissues. This mineral is crucial for muscle function, nerve signaling, and maintaining bone density. Studies have linked higher magnesium intake to increased bone strength and a reduced risk of fractures in older adults, making it indispensable for mobility. However, magnesium deficiency is prevalent, often exacerbated by stress, medications, and poor dietary habits. Many older adults take medications that lower magnesium levels, including diuretics, proton pump inhibitors, and certain blood pressure drugs. Coupled with diets low in magnesium-rich foods, this results in widespread deficiency that can subtly diminish strength, endurance, and flexibility. Replenishing magnesium levels can have an almost immediate effect on leg health, reducing cramps, improving energy, and restoring a sense of ease in movement. Top magnesium-rich foods: leafy greens like spinach and Swiss chard, nuts and seeds, including almonds and pumpkin seeds, whole grains and legumes, avocados and bananas. For those struggling to meet their magnesium needs through diet alone, supplements such as magnesium citrate or glycinate can be effective, as they are more easily absorbed by the body. Potassium. The muscle and bone balancer, potassium is essential for muscle function, nerve transmission, and maintaining fluid balance within cells. A deficiency can lead to muscle cramps, weakness, and increased risk of falls, particularly concerning for older adults. Beyond muscle function, potassium also contributes to bone health by neutralizing acids in the body that can break down bone density over time. Studies suggest that a potassium-rich diet can slow the rate of bone loss, reducing the risk of osteoporosis and keeping the legs structurally strong. Potassium-rich foods, to include bananas and oranges, sweet potatoes and tomatoes, spinach and beans, avocados and coconut water, star health. The recommended daily intake for adults is 2,600 milligrams for women and 3,400 milligrams for men. Achieving this amount is typically possible through a well-balanced diet rich in fruits, vegetables, and legumes. Vitamin K, the calcium guide. Vitamin K is crucial for bone health, as it activates osteocalcin, a protein that binds calcium to the bone matrix, enhancing bone density and strength. Without adequate vitamin K, calcium may be misdirected to soft tissues, increasing the risk of arterial calcification and cardiovascular issues. For older adults, higher vitamin K intake has been associated with stronger bones and a lower risk of fractures. Additionally, vitamin K supports joint health by reducing inflammation, which can alleviate stiffness and discomfort. Vitamin K-rich foods. Leafy greens like kale, spinach, and collard greens, broccoli, and Brussels sprouts. Fermented foods such as natto and aged cheeses, egg yolks, and liver. It's important to note that individuals on blood-thinning medications like warfarin should consult with a healthcare provider before increasing vitamin K intake, as it can interfere with the medication's effectiveness. Vitamin B6, the nerve and muscle enhancer. Vitamin B6 is vital for nerve function, muscle coordination, and the production of neurotransmitters. A deficiency can lead to symptoms like numbness, tingling, and unsteady movements, which are often mistaken for normal aging signs. Beyond its role in nerve health, vitamin B6 helps regulate inflammatory responses in the body, reducing muscle discomfort and enhancing flexibility. It also supports red blood cell production, ensuring muscles receive adequate oxygen for sustained activity. Foods rich in vitamin B6: poultry and fish, potatoes and chickpeas, bananas and fortified cereals, sunflower seeds and pistachios. The recommended daily intake of vitamin B6 varies by age and gender, with older adults typically needing around 1.5 milligrams per day for women and 1.7 milligrams per day for men. While it's generally safe to obtain B6 from food, excessive intake through high-dose supplements should be approached with caution, as long-term overuse can lead to nerve damage. Conclusion: nourish your legs, empower your life. Maintaining leg strength and mobility in older age is achievable through a diet rich in essential nutrients like magnesium, potassium, vitamin K, and vitamin B6. Incorporating these nutrients into your daily meals can enhance muscle function, support bone health, and improve overall quality of life. Remember, a balanced diet is the cornerstone of health. Consult with healthcare professionals before making significant dietary changes or starting supplements, especially if you have existing health conditions or are on medication. If you found this information helpful, please like, comment, and subscribe for more insights into healthy aging and nutrition. Your feedback and questions are always welcome.